What do you say when you don't know the diagnosis yet? And how do you move from uncertainty to clear diagnosis and then to management and consent? Today, we are completing our abdominal series. You already watched Abdominal Pain History Taking, Abdominal Physical Examination. If not, pause this video and watch them first. They are essential. Today is the next crucial step: how to present a diagnosis, how to confirm the diagnosis, how to explain management and obtain informed consent. Let's go. Section 1. Role Play.
Mr. Smith, thank you for explaining your symptoms and allowing me to examine you. Based on what you've told me and on my examination findings, there are a few possible causes for your abdominal pain. At this stage, it could be inflammation of the appendix, a kidney stone, or possibly a bowel-related issue. I'm not in a position to give you a definite diagnosis just yet. To narrow it down, we'll need to run some tests, including blood tests, a urine test, and an abdominal ultrasound. Depending on the results, we may also arrange a CT scan. These tests will help us rule out serious conditions and pinpoint the exact cause. In the meantime, we'll keep you under observation and manage your pain. Do you have any questions so far?
So you're not sure what it is?
At the moment, I can't say with certainty. However, we're taking the right steps to reach a clear diagnosis as quickly as possible. Mr. Smith, your test results are back. The blood tests show raised inflammatory markers, and the CT scan confirms acute appendicitis. This means your appendix is inflamed and needs surgical removal.
Is it serious?
It can become serious if left untreated. There is a risk of rupture, which could lead to a severe infection in the abdomen. The good news is that we've caught it early. The recommended treatment is surgery, specifically a laparoscopic appendectomy. This is a minimally invasive procedure performed under general anesthesia. The aim is to remove the inflamed appendix and prevent complications. The benefits of the operation include relieving your pain, preventing rupture, and reducing the risk of further infection. As with any surgery, there are potential risks, including bleeding, infection, or reactions to anesthesia. However, these complications are relatively uncommon. After the procedure, you'll likely stay in hospital for 1 to 2 days, and recovery usually takes about 1 to 2 weeks. Do you feel you understand the situation?
Yes, I think so.
Would you like me to clarify anything?
No.
If you're happy to proceed, I'll ask you to sign a consent form confirming that you understand the procedure, you're aware of the potential risks, and you agree to go ahead with the surgery. Take your time to read through it and feel free to ask questions.
Okay, I agree.
Thank you. We'll take good care of you.
Section 2. Killer Phrases. Here are powerful collocations and phrases for exams and real consultations. Write them down, practice them aloud. When you're not sure of the diagnosis. Based on your symptoms and examination findings, I'm not in a position to give you a definite diagnosis just yet. We need to run some tests to narrow it down. These tests will help us rule out serious conditions. We'll keep you under observation. Presenting a diagnosis. The results confirm. The scan shows. This means that we've caught it early. Presenting management. The recommended treatment is. The aim of the procedure is to. The benefits include. There are potential risks such as. Complications are relatively uncommon. Obtaining consent. Do you feel you understand the situation? Would you like me to clarify anything? If you're happy to proceed, he'll ask you to sign. Take your time to read through the. Feel free to ask questions. Section 3. Practice. Exercise 1. Choose the correct word. 1. Based on your symptoms and examination findings, I'm not in a position to give you a definite A. Conclusion, B. Diagnosis, C. Decision. Correct answer, diagnosis. Repeat, give a definite diagnosis. 2. We need to run some tests to narrow it A. Off, B. Down, C. Away. Correct answer, down. Repeat, narrow it down. 3. On the scan, appendicitis was ruled A. Out, B. Off, C. Over. Correct answer, out. Repeat, rule out. 4. The blood tests show raised inflammatory A. Levels, B. Markers, C. Factors. Correct answer, markers. Repeat, raised inflammatory markers. 5. Surgery is the recommended course of A. Action, B. Therapy, C. Treatment. Correct answer, treatment. Repeat, course of treatment. 6. As with any procedure, there are potential A. Damages, B. Risks, C. Harms. Correct answer, risks. Repeat, potential risks. 7. If you're happy to proceed, it'll ask you to sign a consent A. Agreement, B. Paper, C. Form. Correct answer, consent form. Exercise 2. Gap filling. 1. I'm not in a position to give a definite. 2. At this stage, it could be a number of possible. 3. We need to carry out further. 4. The CT scan confirms acute. 5. The aim of the procedure is to prevent serious. 6. Do you feel you understand the 7. Please take your time to read through the answers. 1. Diagnosis. 2. Causes. 3. Investigations. 4. Appendicitis. 5. Complications. 6. Situation. 7. Form. Read them aloud. Focus on rhythm and stress. Definite diagnosis. Further investigations. Serious complications. 3. Comment exercise. Now your turn. Write full professional responses. 1. A patient asks, "Doctor, are you absolutely sure about this diagnosis?" How would you respond carefully but confidently? 2. How would you explain surgical risks without frightening the patient? 3. How would you check understanding before asking the patient to sign the consent form? And that's it. Master these phrases. Practice them aloud. Use them in exams. Use them in real consultations. Like, subscribe, and follow Medical English Pro.